Hi, Tamira and Physio Megan here. Today I'm going to talk a little bit about pain and what it is and why we experience it, and a little bit about persistent pain. So in the last video I talked a little bit about reoccurring injuries and how sometimes we might actually need another assessment. It might not be the same injury, but this time I'm going to talk about when we maybe have had all that cleared and the pain is persisting. So pain is considered an output, and pain is there so that you take action. It is designed so that something changes, and that might be rest, it might be going to seek advice from somebody, it might be doing some rehab, but the point of pain is that something changes within the actions that we're doing. So if pain is ongoing and persistent, and we've had everything else ruled out as to why that might be occurring, then as a physio, I would consider this sensitivity of pain. And what I want you to do is imagine that your nervous system is a whole bunch of light bulbs, and in your body, around your tissues and everything like that, sometimes some are switched on, some are switched off. And let's say we pick up a ankle sprain, what happens is more light bulbs get turned on in that region, and that makes us more aware of it, take notice, brightens the area, usually in the form of pain, and that means we'll do things like stop running on it for a bit, seek some advice, do a little bit of rehab. And normally what happens then is as tissue healing occurs, recovery occurs, we start taking actionable steps into addressing the problem, whether that's ice, heat, exercise, etc. These light switches turn off. However, in some instances, this doesn't always occur. And despite tissue healing, despite us being engaged and active in recovery, some of these light bulbs remain. And this means that we get more sensitivity in the region. So now, even though we might have had some imaging, or we might be able to pass some tests that the physio's given us that show that we're getting some adequate recovery within these tissues, it means that when something minor might happen, you might get a little flare up and then it's incredibly painful, and that is because we have an increase in tissue sensitivity. So what we often want to do in rehab is to try and reduce this tissue sensitivity. I think the way that physio tends to go now, we really push this sort of strengthening sort of bandwagon. Oh, it's because you're not strong enough. That's why you're still in pain. You must be weaker. The reason your back's still sore is because you're not strong enough in your core. Your glutes are not strong enough. And we hammer and hammer and hammer this strength message. But actually, if it's the tissue sensitivity that is the problem, it's not that the exercise and the strengthening won't be effective, but there are other things that might actually be helpful to try and reduce that sensitivity. And often this is around graded exposure, and it's about really digging deep, finding out what is triggering that pain, and exploring all the things that might be beneficial to you as an individual. And this can be a really, really individual process, because it can be then fueled by lots of other aspects in terms of your health, such as fear, anxiety about moving, it's been going on for a long time, unsure whether there's any tissue damage there, etc., etc. So if you have had pain for a long time, it is not settling down in the way that you think, or you've been told that everything's fine and dandy and there should be no reason why you're getting pain, then it could be that we're looking at this tissue sensitivity problem. And it's much more about a graded exposure approach, discovering other things that might be sort of increasing the sensitivity, keeping these lights switched on. And our job as a team, as a clinician and as a patient, is all about trying to find the things that will help dim these lights and switch them off a little bit. I hope you found that helpful, guys. Just a very, very brief snippet there on the process of pain. But yeah, just to let you know that it's not always about tissues damage. It's not always about just strengthening everything up because you're weak. There's other aspects of physio and rehab that are really important to help our recovery when it comes to pain. I hope you found that helpful. As always, any questions, please pop them below. Other than that, guys, happy running.